On this week's 51%, we speak with Dr. Rosanne Leipzig about how we can embrace honest aging and look out for our loved ones past age 65.
You got to be careful with the word normal. That being said, there are things that happen to everyone as they age.
We also hear from Dr. Emily Clionsky about the ins and outs of dementia and how you can reduce your risk for the disease. I'm Jessie King. It's all up next on 51%.
I was standing around like one of those girls I had seen in a movie. The whole world was a movie back then. I had my sunglasses on, I wanted to be seen without seeing shy Lolita. I wasn't really in it, I didn't really get it.
You are listening to 51%, a WAMC production dedicated to women's issues and experiences. Thanks for tuning in. I'm Jessie King. Last week we spoke with Dr. Heather Hirsch about the major life transition that is menopause, and I thought we'd take it a little further today and bring you two interviews on aging in general, on life after menopause. And rather than swap skincare recommendations or ways to supposedly anti-age, the ways in which women are pressured to never grow old could be a whole episode in and of itself. But let's just focus on the medical aspects of aging. And as our first guest will tell us, it's important because the body is rapidly changing at this time. And as it turns out, the U.S. as a whole is on the cusp of a major shift. In 10 years, there will be more Americans over age 65 than under the age of 18. Dr. Rosanne Leipzig is an internationally recognized and award-winning doctor specializing in internal medicine, geriatrics, and palliative care. She is the Gerald and May Ellen Ritter Professor and Vice Chair Emerita of the Brookdale Department of Geriatrics and Palliative Medicine at the Icahn School of Medicine at Mount Sinai in New York City. She says her commitment to older adults began with her grandmother, who lived with her family for several years while battling cancer, only to decide that at age 75 she wanted to once again live on her own. Leipzig's latest book is the comprehensive guide Honest Aging, an Insider's Guide to the Second Half of Life. In it, she tackles everything from falls and chronic diseases to how to advocate for yourself against doctors and caregivers. She says the most common question she receives from patients is, should I be worried? Is this a normal part of aging?
So normal is an interesting term, okay, because when we talk about normal, we talk about what's happening to most people, right? And even if things are happening to most older people, it doesn't mean that it's good for them, all right? An example is high blood pressure. So 90% of 90-year-olds have high blood pressure. And when I was in training, we didn't treat it because we were told it was normal. And then they treated it, they did the studies, and they found out that people were a third less likely to have a stroke or to have heart failure. You got to be careful with the word normal. That being said, there are things that happen to everyone as they age. Examples of that would be things like you're going to walk more slowly. You're not going to be able to get to the point of fitness that you were at a younger age. You can certainly get a lot better, but you're not going to be able to be back where you were when you were 20 or even 40. Your arms are going to be flabby, and you're going to have a pot belly. And I get a lot of patients who come and ask me how they can get rid of the pot belly. And in truth, it's a part of normal aging. The fat distribution in the body changes. It goes away from the arms and it goes into the belly. You're more sensitive to medications for several different reasons. One is you get more bang for the buck, so that a given dose of a given medication results in a greater effect than it did when you were younger because of the way your body deals with the medication. And the flip side of that is the organs of the body tend to be more sensitive, particularly the brain. So for many reasons, older people need smaller amounts of medications. Everybody gets up more at night to urinate. It's not fair, but it's true. When you have weather like we've been having, you're less likely to get thirsty. And because of that, you're more likely to get dehydrated and get into real trouble. So I tell my patients always they need to count the number of glasses a day and make sure they're taking in enough fluid, because waiting until you're thirsty isn't going to work. Diseases present differently. So heart attacks are less likely to present with chest pain and pressure, more likely with shortness of breath, confusion, lightheadedness. So there are lots of things like that. They're normal, okay? They happen to everybody at some point as they get older. But you need to know what to expect and how to adapt.
Looking back on some of the patients you've treated, what are some of the different ways you see people confront aging or adapting to their new normal? Is there a method or mindset that you feel helped or made things easier?
Sure. We live in a world that is extremely ageist. And it's a funny thing because all of us, if we're lucky, will become old. So we're prejudiced against our future selves. And we deny that this is going to happen to us in all sorts of different ways. So my way of looking at how you can age is I think of people who are wise old owls. They want to know everything that could be happening and figure out how to deal with it. There are those people who are kind of worrywarts. They're afraid to know things because they're afraid these things are going to happen to them, instead of trying to be proactive and feeling empowered to be able to change that or make it not happen. And then the third group are the ostriches, those people who have their heads in the sand. And of course, I like the wise old owls. But I think the other thing that's really important for people is to think about their perspectives on aging. It's how you consider being old that really influences how your old age will be. And there's studies that actually show that attitude really matters.
So let's talk about things that aren't considered normal. Your book has a lot of advice on chronic diseases like cardiovascular disease or diabetes and how those things might turn up and present themselves depending on your age. You also walk through the different types of screenings that are out there to monitor for these kinds of things, but you note that over-screening can also be an issue. What do you mean by that, I guess? What kinds of things should people look out for?
There are a couple of ways to look at that in terms of catching something early, all right? Sometimes it's good. Sometimes it really doesn't help. So there's a lot of things out there right now talking about screening. And, you can turn on the TV and for $100 or $200, they'll screen every part of your body and tell you what's wrong. And as you get older, that becomes, in a sense, less important because you may not live long enough for that to actually manifest itself in any way that you would know about it. Other things will most likely be more important in terms of your health, and it can lead you down a rabbit hole. So I get worried about that. I think the more important thing to do is to figure out what's bothering you, what's interfering with your ability to have the life you want to have. And that's where you need to start talking to someone about these things. And a lot of times people will say, well, what do you expect? You're 85, you're 90. That's not an answer. And it's not an answer to accept from a doctor.
I was going to ask, how should your approach to healthcare change as you get older? You talk a lot in the book about the importance of advocating for yourself because of those responses where people are like, well, that's just part of aging and then being waved away. How should people be tackling their healthcare?
Absolutely. I think the first thing is to make sure you have a doctor who acknowledges that 80 isn't 60. It's not the new 60, okay? There are changes that occur, and that they're aware of what those sorts of things are. The second thing is to have a real relationship with your doctor as much as you can. In medical school, we learned that 80% of making the diagnosis has to do with the history, which means listening to someone and hearing about it. So I think it's really important. You've got to feel like you can have that conversation with your doctor. And you also have to feel like your doctor is fine with your asking questions. And, it's a problem these days. I'm not going to pretend that this time limit on being able to see patients doesn't get in the way of having a good doctor-patient relationship. But what you can do is think about what your questions are before you walk in the office. And what I ask my patients to do is to make a list and then prioritize what are the top 2 or 3 things they want to make sure we get to during that visit.
One thing I really appreciated about the book is that you have a lot of advice for loved ones as well, so not just for those who are over 65. watching your parents or grandparents, the people in your life that you care about, get older and, less able to take care of themselves is hard. And it brings up a lot of hard decisions to make about, where should they live? How long should you keep driving? Should you bring in someone to help them? How do you recommend families navigate those kinds of conversations, especially, when both sides don't see eye to eye on it?
That's a great question. And I think every caregiver has to negotiate that, okay? But I think the first thing to do is to recognize that you are dealing with an adult who actually, much of the time, had something to do with your growing up and raising you. Somebody who has been independent and has a lifetime's worth of wisdom and decision-making on their own. And yes, their lives are changing, and that's a hard thing to deal with, no question. So I think the first thing to do is to try and establish and remember that the relationship is the most important thing, and figure out what, I keep saying this, but I mean it, what matters most. What's the most important thing to the older person? And sometimes the caregivers have to take a step back when an older person feels very strongly about something. I think we need to change our idea of what independence is. And nobody wants to be dependent. But on the other hand, we often need help to do what we want to do. But the one thing you absolutely have to do is be honest with each other. Because you need to know where the other person is coming from. You need to have yourself in their shoes. And they need to be in yours.
When you think about the biggest issues in your field right now, what comes to mind? How can we better take care of our older populations?
I kind of divide this up into individuals taking better care of themselves, okay? And to that I say aging begins at birth. There are lots of things that you can do throughout your life so that you will have a better old age and you'll be in better shape in terms of how you eat, how you exercise, that you don't smoke, that you drink. If you drink in moderation, things of that nature. The second piece of that, from the individual point of view, is that you feel empowered to find out what's going on when you think there's a problem. And a lot of older people don't feel that way and are discouraged from feeling that way. Our healthcare system is very broken. Anybody who is willing to help you get through it and figure out what's going on, you should jump at, okay? So I think from an individual point of view, that's where I would be. And take advantage of what does exist in communities. The second problem I see is that we don't have enough geriatricians, and that's physicians who are specially trained in the care of older adults. I'm not saying that every older adult needs to be cared for by a geriatrician. Geriatricians are needed for complex care, but the numbers are low, and we need to make sure that every primary care doctor, every cardiac doctor, every surgeon knows what they need to know to appropriately care for older adults. Again, 80 is not 60. And then the third thing is I think our country is absolutely not ready for this. In 2034, we will have more people over the age of 65 than under 18 in this country. It's kind of mind-blowing when you think about it. And how are they going to live their old age? Well, if we're able to expand the years that they're healthy, that's great. But everybody at this point, most people, have a period of time where they're not that healthy. They need help in different ways. And when you ask people, there was an article in the Times a few months ago asking 12 or 14 older people where they expected to live out their days, so to speak. I think it was 70 or 80% said at home. Well, that's a nice thought, but how are you going to do it? Who's going to be with you? How can you afford to have somebody with you? We have a whole problem with the home health aide profession, that we don't give people a living wage or a career path. So people aren't really running to do that. And we just have not tried to create age-friendly environments for older adults.
You've kind of touched on it already, but, as I look forward to hopefully getting older, how can you put yourself on the path for a more positive experience with aging and to stay healthy?
So the first thing to do is spend time with older folks. Get to know them. Appreciate, and I have a number of older folks who have been role models to me. You need to have a positive view of this incredible 20 to 40 years that you're going to have with the kids gone or not having to go to work every day. It's really a gift. And so you need to think about what you would want to do during that time as well. We spend a lot of time thinking about what our career is going to be, but we don't spend a lot of time thinking about what we're going to do in retirement. Physically, I think you need to have some sort of exercise built into your life. And it doesn't have to be no pain, no gain. It doesn't need to be something that makes you very uncomfortable or short of breath. It needs to be a regular habit so that you are giving your muscles, your flexibility, your strength, your balance, and your heart every chance it can have. And exercise is really the only age drug that we have, okay? It has been shown to help with cognition. It has been shown to help with sleep, with mood. I can keep going on with that. It's also a chance to do something with other people. So socialization is really important, and keeping up those social networks, which you start now. And of course, as your life goes on, you continue to add to. Healthy diets. We're all trying to eat less red meat, more of a Mediterranean type diet. There are other diets like that out there that help. Brain health is heart health. So the things that we do, like watching our cholesterol, our blood pressure, not smoking, those are things to really be doing at this point in your life. There are a lot of things that get better as you get older. You don't care so much about what other people have to say or think about you, okay? You're more likely to say what you're thinking. It's a time that you can do things that you never had time for before, or you never realized you might be interested in. And it's a time to give back. It can be a time of meaning. So I think this negative spin that we have on aging has to change. And we really do need to recognize that there's a lot of good, a lot of fun. You can have an enjoyable, engaged, and meaningful old age.
Dr. Rosanne Leipzig specializes in internal medicine, geriatrics, and palliative care, and teaches at the Icahn School of Medicine at Mount Sinai in New York City. Her latest book is Honest Aging, an insider's guide to the second half of life, out now through Johns Hopkins University Press at most major booksellers. If there's anything you wish we covered here, I'm betting you will find it there. Dr. Leipzig, thanks so much for joining us today.
My pleasure. It's been great talking with you.
The loss of cognitive functioning, or dementia, is a common concern for aging populations. More likely than not, you or someone you know has been impacted by it. The disease currently afflicts more than 55 million people worldwide, according to the World Health Organization. And according to Alzheimer's Disease International, dementia disproportionately impacts women. More women than men live with it, more women are at risk of developing it, and their symptoms are generally more severe. But as we've been hearing, dementia's prevalence does not make it normal. And as our next guest argues, you can work to lower your risk. Dr. Emily Clionsky is an internal medicine doctor and diplomate of the American Board of Psychiatry and Neurology, with her own private practice, Clionsky Neurosystems, in Springfield, Massachusetts. With her husband, Dr. Mitchell Clionsky, she's helped countless patients suffering from cognitive decline. And in their new book, Dementia Prevention, Using Your Head to Save Your Brain, they offer a step-by-step checklist to help readers assess their risk and figure out how they might be able to get ahead of the issue. There's a lot of talk about Alzheimer's disease in the news right now. Of course, it's the most common form of dementia, and just recently the FDA gave full approval for a new drug it says could be a treatment, although it does not reverse symptoms, just slow them down. I spoke with Dr. Clionsky before this news, so just bear that in mind as you're listening. But she says it's important to remember that there are several types of dementia, and warning signs and treatment plans can differ for each one.
Dementia basically is the condition where our brains are not thinking the way they used to. So it's a departure from whatever our baseline level of intellectual functioning was. And it's generally in more than one area of how our brains think. Everybody thinks about dementia as just affecting your memory, but it's about more than just memory. There's memory, there's executive function. Executive function is the part of your thinking process that keeps you from doing things that are really inadvisable or unwise. It's the part of your brain that allows you to get everything on the dinner table at Thanksgiving time all at the same time, even though they've got different cooking temperatures and different cooking lengths of time. It's the kind of thinking in your brain that allows you to organize, plan, understand abstractions. So there's also a language capacity to our thinking, and there's visual spatial orientation. So it's all those things put together. So you can have deficits in one area of brain function, such as memory, and that's really the sine qua non of Alzheimer's disease. There's a loss of short-term memory, and they can remember what happened when they were 20 and 30, but ask them what happened 2 hours ago or yesterday and forget it. You're not going to get an answer. But vascular dementia, which is another large category of dementias, is what happens in our brain when the microscopic blood vessels that supply all the brain cells get clogged up because we've got bad cholesterol or we've got diabetes. That, it's not so much memory that's the problem. It's paying attention and being able to keep multiple things in mind. So multitasking goes out the window with vascular dementia. Dementia is just a broad umbrella term for a generalized state of disease that our brains don't function the right way anymore. And there's about 400 different things that cause different types of dementia, some of which are reversible, some of which are not.
So let's get into some of those risk factors. What are the risk factors for dementia, and is there anything you can do about them?
The biggest risk factor, believe it or not, is age, and none of us control that. We also cannot control who our parents were, so we can't control our genetic inheritance. So if there is major risk factors genetically for certain kinds of heritable dementias, we can't control that. Other risk factors that are controllable are things that have to do with lifestyle and whether we're getting the proper nutrition and whether we're being really smart about what we let into our bodies. Let me give you some for instances. And this is all what we call evidence-based medicine. So this is not just my opinion. This is data from the Lancet Commission, the World Health Organization, and this has all been vetted by Johns Hopkins University Press. So it's things like traumatic brain injury. If you are a young person and you're playing soccer or football or basketball, I really want you to be careful about protecting your head, because every single concussion you have when you're young or in middle age will literally affect whether and when you're going to get demented or not. Smoking cigarettes, it's a tough habit to break. I had to break it. A lot of us had to break it. But we know that tobacco contributes to dementing processes like clogging up your arteries in your brain and in your heart. We know that it, for instance, also high blood pressure, diabetes, which is very, very controllable. We know that 1 out of 4 cases of diabetes is heritable. But if you know that your mom had diabetes and maybe your mom was carrying around an extra 15 pounds, well, then that kind of there are 2 factors right there that our book directs you into a new way of how to handle that risk factor and minimize that risk factor. Then there's some other things, and those are the common things everybody knows about. But there's a lot of things that a lot of people don't know about, especially women. Let me give you an example. Obstructive sleep apnea. Most doctors today still don't screen women for this condition. And that's what happens when we're sleeping and our brains don't get enough oxygen, because the airway actually relaxes when we're sleeping, especially if we're dreaming. And the air doesn't go down our airway, doesn't get into our lungs, which means that the oxygen doesn't get onto our little red blood cells that carry that critical oxygen to our brains when we're sleeping. So when that happens, those brain cells start to be injured and get damaged and eventually die. Now, most doctors, believe it or not, still today think that it's only men who have obstructive sleep apnea. Generally men who are very overweight, have big, thick necks, have red faces, have high blood pressure, and don't exercise. Well, guess what? I've got obstructive sleep apnea. I take a size 4. I don't have a big neck, but I am postmenopausal. So the major risk factor here for women is postmenopausal is not at 60. Perimenopause in this country starts at 42. And when we start to lose our estrogen, those airway muscles in our airway start to change and become like a man's. So our risk factor for obstructive sleep apnea becomes equivalent to a man's when we're going through menopause, is the equivalent as a man's after menopause. And by the time that we hit 65 in this country, 1 out of 3 of us have obstructive sleep apnea, which is not diagnosed by our primary care doctors. It happens to be like one of the most major risk factors for developing dementia. And we've known that for decades. Other things like homocysteine and not enough vitamin B12 and iron deficiency. You know, we think when we go to the doctor that the doctors are checking us for all these vital nutrients. Vitamin D is another big one. Well, that's not really happening. That's not the way medicine is practiced today. So what we've done in the book is we've actually developed a checklist for you so that you can read about all these preventable, changeable, reversible conditions. And then we actually give you what the goals are, and you can do your own little checklist, figure out where you're at today. And when things need to be fixed with your doctor's help, like get labs for certain things that need to be optimized, you can actually take this to your doctor and say, look, here's the book, here's where I'm at. Let's do a better plan to keep me from getting demented like my mother was or like my father was.
How do you treat sleep apnea like that?
Well, it's actually a pretty simple thing. We use something called continuous positive airway pressure. And when you go to sleep at night, you put on a little device that actually is connected to a machine that's very quiet. You can't hear it. And it takes room air and it makes sure that that room air is going down your air pipe and keeping your windpipe open so that your lungs can actually get the air that you need and your brain can get the air that you need and the oxygen you need. I should tell you this, that all of this came out of my practice. When I first went into my last practice in 2007, by that time I was both an internal medicine doctor as well as a psychiatrist. And I decided to do everything I could to optimize the health of my dementia patients, because while there's no cure for Alzheimer's, there's no pill you can take, there's no special food you can eat that's going to reverse it. But I reasoned that if I fix everything that's fixable, that's preventable, that can cause dementia, then these people should do better. Well, 82% of my patients had a lack of oxygen in their brain at night. And that included skinny little women. 45% of them had hyperhomocystinemia, which points, it's a fancy term, but it points to a deficiency in vitamin B12 or folic acid, which is vitamin B9. And if you live in New England, chances are there's a 95% of us in New England actually don't have enough vitamin D, as in David. And that causes depression and is a known factor leading to dementia. So when we looked at all the statistics from my practice, and we realized that when we fixed those factors and then used the standard dementia medicines that have been available for the last 15 years, that these patients not only stabilized, but they, after the first 6 months, they actually improved in their cognition and then stayed stable anywhere from 3 to 5 years after that. So if somebody in your family has dementia, or you know someone who is beginning to say, gee, I can't remember what I went into the grocery store for, or like I was doing, My husband would tell me that we had a conversation a week ago, and I'd swear that we didn't. This is the kind of thing where you can go through that checklist, take it to your doctor and say, look, I want to start now making sure that there's nothing wrong with me so that when I am 50, 60, 70, 80, 90, I'll still be able to enjoy my life the way I want to.
That goes into one of my next questions, actually. What would you consider the warning signs of dementia? What is the difference between, like a so-called senior moment and something that you should be concerned about and follow up on?
So let me relax you, first of all. If you forget somebody's name, don't get panic-stricken. We all forget people's names occasionally. It's when on a regular basis that you're forgetting 3 out of the 5 things going into the grocery store, or there's a couple of important things coming up and they just slip your mind. If bills aren't paid, that's a big thing. If someone forgets that they need to take their medicines, that's a pretty big thing. Those are early kind of warning signs. There are other things that are more specific. Being forgetful of words, having word finding difficulty in everyday conversation. That leads, when it gets severe, to something called aphasia, which we've just heard about because a certain actor has been diagnosed with frontal cortical dementia. And an expression of that is the inability to talk and to communicate the way you used to. So it depends on what kind of dementia process we're talking about. But what's really most significant is if you notice that there's a pattern that is consistent over time, like 6 months, that's worrisome to you, that's the kind of thing to bring to the attention of your doctor.
So if you or someone you love starts showing these signs, what can you expect? When you go to your doctor for a diagnosis or treatment, as you said, there's no cure here, but is there anything you can do? What kind of plans should you be hoping to go on?
So it depends to some degree on what the pathology is, what kind of dementia you have. In any case, the first goal should be reverse everything that can be fixed. So optimize your oxygen. Get rid of tobacco if you're smoking. If you are drinking alcohol or using marijuana, my suggestion is to stop. If you're not getting any exercise, please start getting at least 30 minutes a day. And you can do it in little bites, like 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes at night. But I really want you to build to 210 minutes of exercise, aerobic exercise a week. Get tested. Get somebody to evaluate you and figure out, gee, are you just being worried about this? Or is there something really to be concerned about? And neuropsychological testing can actually determine that. A doctor can do other little kind of quick tests in her office to help figure out if there's an objective problem or if it's a subjective feeling that you're having. But if it turns out that there might be something really wrong, there's diagnostics that can be done. An MRI can be done, although that's not necessary. And you can start taking medication. I believe that the sooner we start treating dementia with the standard medications that are currently available, the better those patients will do over time. That's what the literature says. That's what my practice has indicated. So reverse everything that's fixable, start the best medication that you possibly can, get that exercise going, and get rid of some of the bad habits.
You've done a lot of research in this area, and there's been a lot of work out there, too, to find new treatments for things like Alzheimer's. Where do you see the research heading, and is there anything you'd like to see it focus more on?
Dementia research really took off in the 70s and the 80s, even though that we've known about dementia for over 100 years at this point. And unfortunately, right now, everyone is stuck in the notion that the only kind of dementia is Alzheimer's disease, which is not the case. It is one of the leading types, but it's not the only type. And so we need to expand the scope of how we approach dementia, both from a specialist standpoint and a research standpoint. So we need to understand how to better control somebody's high blood pressure, somebody's atherosclerotic risk disease, how to control those cholesterols, that diabetes, how to fix their obstructive sleep apnea. More importantly, we need to get away from the idea that the only thing involved in Alzheimer's disease is beta amyloid plaque, because that's not the only thing. So we are just now beginning to expand our horizons so that we're beginning to appreciate how complex a disease state this is, regardless of what type of dementia you have. It's not going to be one pill. It's not going to be one treatment. It's not going to be one thing that you eat. This is a multi-pronged kind of research approach that's now going on that is reflected in the book as to what's working and what's not. And I think you're going to be seeing more of that.
Well, Dr. Clionsky, thanks so much for taking the time. Is there anything I'm missing that you'd like our listeners to know?
Dementia is not a death sentence. Stop being a dementia warrior and become a prevention warrior, because that's the way you can take control of your life, use your head to save your brain, and actually enjoy the rest of your life for, the next 10, 20, 30, 40, 50 years, and hopefully in your case.
Dr. Emily Clionsky is a doctor of internal medicine and a diplomate of the American Board of Psychiatry and Neurology. With her husband, Dr. Mitchell Clionsky, she helps patients suffering from cognitive decline out of her private practice, Clionsky Neurosystems, in Springfield, Massachusetts. Their new book is Dementia Prevention, Using Your Head to Save Your Brain, out now through Johns Hopkins University Press, and you can find it at most major booksellers. To hear today's interviews in full, unfortunately, there are only so many minutes in a show. Check us out at our website. We'll have everything there. That's WAMCpodcast.org. Thanks for listening to this week's 51%. 51% is a national production of WAMC Northeast Public Radio in Albany, New York. It's produced and hosted by me, Jesse King. Our associate producer is Jody Cowan, and our theme is Lolita by the Albany-based artist Girl Blue. Just a reminder that you can listen to 51% anytime at WAMCpodcast.org or wherever you get your podcasts. On social media, we're at WAMC Radio, and you can stay in the loop by signing up for our weekly newsletter, Airwaves, at WAMC.org. We hope you'll join us next week. Until then, I'm Jesse King, 51%.
I was every single girl, I was nobody else, I was so sure of myself. I was 15 and a half. He was a hollow laugh, and I lost my cool somewhere along the way. At night, down the hallway, I had to learn how to look away. I lost my cool.